Jane Halton, thanks for joining us.
Good evening.
We now have multiple cases of coronavirus across Sydney, all linked to the outbreak in the hotel in southwest Sydney. How concerned are you by this?
Well, obviously we should all be concerned. Any outbreak of COVID-19 across our community tells us that we need to be enormously careful, practice social distancing, really good hygiene, because it's a proof positive that this spreads and it spreads quickly.
Does it worry you, if this isn't nipped in the bud in Sydney, that parts of Sydney, if indeed all of Sydney, could be heading into a Melbourne-style lockdown?
Well, I think that's the warning to us, isn't it? We're seeing those of us who are in New South Wales, what's going on in Victoria, and we feel so much for our Victorian friends and colleagues. And the way we stop having to take those kinds of steps now across New South Wales or in parts of New South Wales is by doing those things about hygiene, because we have to get this under control, but that's in our hands.
Have people become, too complacent?
Well, I never like to use the word complacent, but I do think there is perhaps a level of fatigue with the hygiene message. And I do think it's important to remind ourselves that until we have a vaccine or good treatments, this is not going to go away anytime soon. So we all need to double down on the things that we know work.
I want to talk about the vaccine in just a moment, but you're also the head of the inquiry into hotel quarantine in Australia. Obviously, the focus has been on the mishandling of that scheme in Victoria. More broadly, what are you aiming to get at here?
Well, what we want to be sure is that hotel quarantine, which is actually being provided, as you know, to people who are coming back to Australia, there'll be at least 7,000 people in quarantine potentially across the country based on the new arrival limits, that we make sure that those people are well treated, but also that any virus that comes with them into the country stays in quarantine and therefore doesn't leak into the community. Because otherwise we see the kinds of problems we're seeing now. So making sure that's working really well for us, but that people are well treated is really my focus.
How big a bungle was it, in your view, by the Victorian government appointing private security contractors to guard those hotels in Melbourne?
Look, I think it's not a question of what kind of uniform you wear, to be honest with you. I think the issue is, are the people who are providing security or other services really well trained in managing hygiene and infection control? So that's the issue that I'm focused on, because ultimately lots of people who aren't necessarily wearing a uniform or indeed have medical qualifications, they work in situations where they have to practice infection control procedures, and they do it really well. So I want to look to see how well we are doing that in hotel quarantine.
You're also, among the many hats you wear, the chair of a global council spearheading the push for this much-wanted, much-desired vaccine. You may have seen comments by former New Zealand Prime Minister Helen Clark, who was heading up the global inquiry into the pandemic, that in her view, the best case scenario is that an effective vaccine, is at least 2.5 years away. What's your view on that?
We've been saying, and so I chair something called CEPI, we've been saying that it would be at least 18 months before we would be confident whether we could actually have a vaccine. And then we, of course, have to manufacture it and distribute it. So I think, all need to understand there's not going to be a cure-all that's available to us by Christmas. Now, I'm hoping that we will get positive signs out of some of the trials that are running now in human beings around the world. There's nearly 20 that are underway. But, of course, until we see the data that something's safe, that it works, and any kind of effective immunogenicity that you get out of that vaccine lasts, and then we can manufacture. So it's going to take us a while. The good news in Australia is we have a trial starting with the UQ vaccine, which we've been delighted to partner with. But I think this is the point about practicing good hygiene. We're not there yet, and it's going to take us some time.
Jane Halton, thanks for your time.
It's my pleasure.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.